Welcome to the information session for the Department of Education and Early Learning's 2026 Youth Mental Health Therapeutic Services Request for Proposals. This session is intended to help prospective applicants understand the purpose of the RFP, the two service tracks, eligibility requirements, application sections, scoring priorities, and how to submit an application. Before we begin, please have the RFP overview document and the application questions document available from our website. You can have that either in print or electronically, but it'll be helpful for you to reference as we walk through the overview. These documents are going to provide the full details that applicants will need to prepare a complete response. As you go through this presentation, please note your questions and submit them to dealfunding@seattle.gov with the subject line, Question, Youth Mental Health Therapeutic Services RFP. Today's session will cover four main areas. First, we'll review the purpose of the Therapeutic Services RFP. Then we'll walk through the two service tracks and eligibility requirements. After that, we'll review the application sections and scoring criteria. And finally, we'll explain how to apply through the online application portal. The RFP is designed to increase access to high-quality, culturally responsive therapeutic services for Seattle secondary students and youth ages 13 to 24. Funded services will provide direct clinical therapeutic supports, including intake, assessment, treatment planning, and ongoing therapy. A key goal is to reduce barriers to care through low barrier access, outreach, and coordinated referral pathways so youth can connect to services more easily. The total funding available through this RFP is $1 million. Contracts are expected to run from September 1st, 2026 through August 31st, 2027. DEAL anticipates awarding up to $830,000 toward the universal access provider or providers, and up to $170,000 towards specialized services provider or providers. Final award amounts will depend on proposals, contract negotiations, approval of the FEP levy implementation and evaluation plan by Seattle City Council, and the availability of appropriated funds. Please pay close attention to the timeline. The RFP opens on May 18th. The question and answer period closes on June 9th, and applications are due by June 12th. DEAL expects to announce awards on July 7th, with contracts beginning September 1st. Late applications will not be accepted, so applicants should plan ahead and submit early if possible. Eligible applicants may include community-based organizations, health agencies, or private companies with expertise in therapeutic supports, mental health, or behavioral health services. Providers must deliver services through clinicians licensed to provide services in Washington State. Applicants must also be able to meet city and state insurance, licensing, privacy, confidentiality, and regulatory requirements, including systems to protect confidential client information. Current DEAL providers and new applicants may apply as long as they meet the eligibility requirements. The purpose of this funding is to expand access for youth who are underserved by current mental health systems. Therapeutic services may include individual or group therapy, intake, assessment, treatment planning, and ongoing therapy based on youth need. The RFP identifies priority populations based on DEAL's needs assessment, including immigrant and refugee youth, foster youth, and Black, Indigenous, people of color youth who are underserved relative to their share of the Seattle youth population. Applicants should clearly describe how their services are culturally responsive, linguistically appropriate, and aligned with the needs of the youth they propose to serve. This RFP includes two complementary service tracks. The Universal Access track is for a virtual-only, high-capacity provider that can offer rapid, low-barrier access to therapeutic services citywide, including connection to a therapist within 24 to 48 hours. This track is intended to function as a universal entry point for youth seeking support. The specialized services track is for providers offering in-person, virtual, or hybrid care designed to reach youth who may not be effectively served through virtual-only models. This track emphasizes cultural responsiveness, relationship-based engagement, in-language care, and stronger community trust. Selected providers will participate in quarterly reporting, continuous quality improvement, standardized service unit reporting, and performance-based contracting. DEAL will use standardized definitions to support consistency across providers and service models. A youth is considered served when they complete intake and at least one completed clinical session or approved session equivalent. Providers will also need clear processes for care coordination and referral, including identifying youth who need additional or higher levels of support and connecting them to appropriate no-cost youth mental health resources. Now we'll dive into the application sections. Scoring is tailored to the purpose of each service track. The Universal Access track emphasizes scale, rapid access, and operational capacity because it is intended to provide broad, low-barrier virtual access citywide. The Specialized Services track emphasizes experience with priority populations, culturally and linguistically responsive strategies, and relationship-based engagement. Across both tracks, DEAL is looking for high-quality, culturally responsive, evidence-informed care. This slide shows how points are weighted differently by track. For universal access, capacity is weighted most heavily because applicants must demonstrate the ability to serve youth at scale and provide timely access. For specialized services, the priority population strategy is weighted most heavily because this track is designed to reach youth who may face cultural, linguistic, relational, or systemic barriers to care. Applicants should pay close attention to these scoring weights and tailor their responses to the track they select. Applicants must select only one track. You cannot apply for both. Applicants must submit the required DEAL budget template with their application. The budget should identify the selected service track, projected number of unique youth served, staffing assumptions, and major cost drivers. DEAL will review whether the proposed budget is realistic and aligned with the service model, staffing plan, outreach approach, and projected service levels. Strong budget should clearly show how funding will support direct service delivery and the applicant's ability to meet RFP expectations. In Section 1, applicants should describe their organizational experience, mission, and therapeutic approach. They should include how youth move through the service model, from intake and assessment to treatment planning and ongoing therapy. Universal access applicants should describe a scalable virtual engagement model, including how youth are matched with clinicians and how services remain low barrier. Specialized services applicants should describe culturally specific or relationship-based strategies and how their model supports sustained engagement. Section 2 focuses on whether the applicant has the staffing, infrastructure, systems, and implementation plan needed to deliver the proposed services. Applicants should describe projected youth served, clinician availability, intake and scheduling systems, data collection, reporting capacity, and referral tracking. Universal access applicants should demonstrate high volume therapist availability and rapid access. Specialized services applicants may include plans for expansion or phased implementation, especially if they are building additional clinical capacity. Section 4 asks applicants to describe the populations they propose to serve, the barriers those youth may experience, and the culturally and linguistically responsive strategies they will use. Applicants should show a strong understanding of youth needs, including barriers such as stigma, language access, lack of culturally responsive providers, and limited trust in systems. Universal access applicants should describe how they will equitably serve diverse youth citywide. Specialized services applicants should demonstrate deep experience with priority populations and specific strategies for in-language care, trust building, and sustained engagement. Section 5 focuses on service quality, outcomes, and evidence of impact. Applicants should provide both quantitative and qualitative evidence where available, including outcomes related to youth engagement, retention, reduced stress, anxiety, or depression, and positive youth benefit from services. Applicants should also describe the evidence base for their model and how they use data for continuous improvement. Strong responses will show not only that services are delivered, but that youth are meaningfully engaged and benefiting from care. Applications must be submitted through the online submittable portal. Applicants will need to create or sign into a submittable account, complete the application form, upload required materials, and submit by the deadline. The form can be saved as a draft along the way, but saved drafts are not considered submitted applications. The portal will close automatically on June 12, 2026 at 11:59 p.m. If your organization is new to Submittable, you will need to create an account. Deal recommends that each organization designates one individual to create the account and submit the application, because the email connected to that account will be the primary contact for submission updates. After signing up, applicants should verify their email address through the confirmation message from Submittable. For technical questions, applicants should use Submittable's support resources and also contact Deal if needed. Applicants may save progress on the online application by using the Save Draft button. Deal is also providing an optional Word version of the application questions for internal drafting and collaboration. However, the Word version is not an official submission and will not be accepted in place of the online form. Applicants must copy final responses into Submittable and submit the online application before the deadline. To submit, applicants must click the Submit button at the bottom of the online application before the deadline of June 12th at 11:59 p.m. Late applications will not be accepted. After submitting, applicants should receive a confirmation email from notifications at email.submittable.com. That email is proof of submission. If you do not receive confirmation, contact Deal as soon as possible using the RFP question subject line shown in the deck. Thank you for your interest in the Youth Mental Health Therapeutic Services RFP and in supporting Seattle youth. Please submit any questions to dealfunding@seattle.gov with the subject line question, Youth Mental Health Therapeutic Services RFP. Deal will respond according to the RFP questions and answer process, so all applicants have access to the same information.